After knowing the different parts of the upper limb, another point I am telling you first of all about the different parts of the upper limb and what is the difference between the upper limb and this. Alright, look, as I told you that pelvic girdle, which is consisting of the two bones, these are the scapula, clavicle, and this is the humerus. Look this part. This is the acromioclavicular part, and the different parts of the upper limb are the arm bone is the humerus, forearm bones are the radius and ulna. This is the wrist joint, and carpal bones are there, which are 8 in number. This is the hand having the metacarpal 5 and the phalanges. The first phalanx, that is the thumb, is having the 2, otherwise rest are of the 3 phalanges. Now, there is the difference between upper limb of the human being and the primates. The difference is that you know that you can hold the anything, that is called the hold grip, and another thing, the pressure grip. So I am telling you there are the different type of the grips. The two grips, that hook grip and the power grip, they are present in all higher primates. That means they are present in the higher class of primates. I am using the word primates. But in human being, there is the third type of the grip, that is called precision grip. And the precision grip is present only in the human beings, not in higher primates. So we must know that what is the precision grip. As I am holding this remote, you can hold the pen. 50% of you are holding the pen. Rest of the 50% are not holding the pen because they don't write. Am I wrong? Now why you started now? I have noticed each and everything, don't worry. So, the precision grip is by which the human being can hold the pen, pencil, can draw, and can artistic diagram and everything. That is called precision grip. And this precision grip is present only in the human beings, not in higher primates. आपने किसी डॉग या quadrupeds को किसी को पेन पेंसिल पकड़ते देखा? So that precision grip is present only in the human beings. So these are the 3 grips. Now let's see. This precision grip, for performing this precision grip, our hand is having some specialties which are not present in higher primates. What are these specialties? This is the forearm. You can do in the forearm these movements. This is pronation, supination. These 2 movements, they are present at the superior radioulnar joint, that is the joint between the radius and ulna above. That is called superior radioulnar joint. Below, just above the wrist, there is the inferior radioulnar joint. So these joints are present in the forearm of the human being, by which the human being can do pronation and supination. Second thing which is evolutionarily developed, that is, we can rotate the thumb 90 degrees. We can do the opposition movements, and also you can rotate the thumb, which are not present in the primates. These are the things. And third, or whether you can say the first one, that is presence of the clavicle. Clavicle acts as a strut by which the upper limb hangs by the side of the body. So all these movements or all these structures developed evolutionarily to provide the precision movements. Follow this thing? So all these things they develop according to the evolution. Please close the gate. Now this diagram I am showing you that whenever we hold the thing or press the thing or pull, whatever the all these movements they require the force. Suppose we are holding the box or anything. Now the pressure, how the pressure reaches to the trunk, that is shown by this diagram. Direction of the force. Look here. First of all, as we hold the anything by the hand, so force directed by this arrow and come to the forearm. As it comes in the forearm, first of all over the radius. Try to understand. The pressure from the hand passing first of all to the radius, from the radius and ulna. You are seeing here the interpreted lines. These are the interosseous membrane which are connecting the two bones simultaneously. So the force from the radius is directed through the interosseous membrane and come to the ulna. From the ulna, the force is directed to the humerus. How? Through the joint, and that joint is between the lower end of the humerus and upper end of the ulna. So name of the joint is humero-ulnar joint. So the force from the ulna comes to the humerus through the humero-ulnar joint. Now it comes over the humerus, arm, and in the arm, through this joint, head of the humerus articulating with the glenoid cavity of the scapula, that is the shoulder joint. So the force from the arm pass to the scapula through the shoulder joint. As it comes over the shoulder joint, now see, the scapula this is the coracoid process of the scapula. The coracoid process of the scapula connecting with the clavicle by the joint, and that joint is called coracoacromial joint or ligament. So force from the scapula comes through this ligament, and that ligament is between the coracoid process and acromion. So that is called coracoacromial ligament. Through this ligament, the force comes over the clavicle. As the force comes over the clavicle, it is directing to the trunk by the two directions. See this carefully. One, it is coming through this ligament, and this ligament is present between the sternum and or here the part of the costal cartilages. The ribs are articulating with the sternum by means of the costal cartilages. So this is called costoclavicular ligament. So the force, one direction comes through the costoclavicular ligament to the part of the sternum, and another it is passing from clavicle directly to the sternum. That is the sternoclavicular ligament. So that is the direction of the force. Whenever we used or lift anything, that is the way how the force is directed from the hand to the trunk. Don't be serious. That is very simple. Force from the hand come to the radius, then through the interosseous membrane come to the ulna, then through the ulnar humeral joint come to the arm, and from the arm through the ligaments of the clavicle, and this comes to the trunk. All right. That is the different parts of the upper limb. Here I want to say one thing more. This is the shoulder joint and this is the hip joint. If we compare the two, shoulder joint is weak compared to the hip joint because it is not so weight bearing The hip joint is completely weight bearing of our body. Shoulder joint is not weight bearing joint. So it is comparatively weak and freely movable as compared to the hip joint. You can do the circumflexion very clearly. Can you do the circumflexion in the hip joint? करके देखना बाद में, after the class. That is not so clearly. All right. Now let's see how they develop, how the limbs develop. In the embryo, at the 4th week of intrauterine life, at the 4th week of intrauterine life, on the anterolateral aspect of the embryo, suppose this is the embryo, towards facing me posterior lateral surface and facing your side anterolateral surface. So, anterolateral surface of the embryo at the 4th week of intrauterine life, there is elevation, pairs of elevation. These pairs of elevations, they appear, one is at the level of lower cervical vertebrae anterolaterally. This is called limb bud of the upper limb. In other words, the limb bud of upper limb appears at the 4th week of intrauterine life anterolaterally at the level of the lower part of the cervical vertebrae. Here is the cervical vertebrae. So at the lower part of the cervical vertebrae, on the anterolateral surface of embryo, there appears the upper limb bud. The lower limb bud, they appears also at the 4th week of intrauterine life, but posterolaterally at the level of lower part of the lumbar vertebrae and upper part of the sacrum. These limb buds, they give rise to development of the upper limb and lower limb. So that is all about the upper limb. Now today's topic is the pectoral region. Very simple. If you will take anatomy by clear yourself, then it is just like novel. But if you will read it like under stress, definitely it will be hard. अब तक समझ में आ गया आपको? Okay. Now pectoral region. This is the region thorax. No doubt. The upper part of the thorax, I am using the word upper part of the thorax, is called pectoral region. Upper part, the anterior surface or the front of the upper part of the thorax is the pectoral region. Let's see the boundary of the pectoral region. So the anterior part of the upper surface of pectoral region, I am using the word anterior surface. So what is lying posterior to this? Ribs or not? Pectoral region, I am using the word anterior surface of the upper part of the thorax. This whole is the thorax. Take its upper part. Okay. The anterior surface of the upper part of the thorax is the pectoral region. Now see, on lateral side, what is this? Axilla. Laterally is the axilla. Medially is the sternum. No problem. Posteriorly are the ribs. Posteriorly are the ribs. And I am using the word upper 6 ribs because we are using the upper part of the thorax. So naturally the upper 6 ribs will forming its posterior ball. Okay. The various structures are present in the pectoral region. These structures are the muscles which are connecting the upper limb with the trunk. A group of muscles which are connecting upper limb with the trunk. First thing. In female, there is present the mammary gland and also the subcutaneous muscle, that is platysma. Subcutaneous muscle, that is platysma. So all these structures, they are lying superficially in the pectoral region. So that is the part which I will start. But before this, you must have the knowledge what are the structures lying in the upper limb. Look this diagram. In upper limb, you will come across the nerves, and the nerves which are you will read in the upper limb, they are the branches of brachial plexus. They are the branches of brachial plexus. The brachial plexus is formed by the spinal nerves of C5 to C8 and T1. That means there are 8 cervical vertebrae, and the nerves which are coming 7 cervical vertebrae, and the nerves are coming the C8 spinal nerves and the part of the T1, thoracic one. So all these ventral rami, I will talk this in brachial plexus, just at present listen. The nerves of the upper limb are coming from the brachial plexus. Forget the root value at present, because you will surrounding around the root value and the other thing you will not listen. These nerves which you will come across or read in the upper limb are the following nerves. First is the musculocutaneous nerve, that is this one, and see the interpreted line which is just lying on the posterior surface of the arm and continue giving the branch on the front of the forearm and again coming to the back. That is the radial nerve. So musculocutaneous nerve, radial nerve, and median nerve, as the name median nerve, so it is running throughout the arm and also forearm. And medial side there is the ulnar nerve. So all these nerves, they are the branches of brachial plexus. So you will read all these nerves. Whenever we talk the muscles, the nerve supply of the muscles, they will give the different nerves to different muscles. And it will ask to you in exam, what is this muscle? Identify the muscle. What is its nerve supply? What is its action? Like that. So after knowing this, the various nerves you will read in the part of upper limb. Similarly, you must familiar about the arteries which are supplying the blood to the upper limb. As we start here, there is the artery, subclavian artery. The subclavian artery is running its course up to the outer border of the first rib. This is the first rib, so up to the outer border of the first rib, that is the part running to this part. So up to the outer border of the first rib, this is the subclavian artery. Then it becomes, at the outer border of the first rib, it becomes axillary artery. That axillary artery running its course in the axilla. And this axillary artery at the outer border of teres major continued into the brachial artery. And brachial artery lying here in the part of the arm. You can see this diagram. So subclavian artery, this one, and coming to here at the outer border of the first rib continued into axillary artery running its course in the axilla, and outer border of the teres major, it becomes brachial artery, and that brachial artery running in the arm. And just as it brachial artery comes below the elbow joint, just 1.5 or 2 centimeter below the elbow joint, it again divides into two. The one which is going to the lateral side, that is the radial artery, and one which going to the medial side, that is ulnar artery. So in the forearm, there will be the radial artery on the lateral side, ulnar artery on the medial side. As they come into the hand, the radial artery, look here, this radial artery terminates to form the deep palmar arch. This radial artery, the termination of the radial artery, it joins with the one branch of the ulnar artery, and terminate as deep palmar arch, while the ulnar artery as similarly joins with the short branch of the radial artery and forming the superficial palmar arch. So that is the blood supply of the upper limb. It not means that we finish. You will read the blood supply in detail. I am just giving you idea that what are the different branches. You will see here the different nerves and different arteries in the upper limb. मैं बाद में बात करूंगा, अभी क्लास ले रहा हूँ. Similarly, look the veins. There is dorsal venous arch is present over the hand. Dorsal venous arch. The venous arch present on the front, that is called palmar arch. But I am talking of dorsal venous arch present on the dorsum of the hand. This is the dorsal surface of the hand, no problem. The venous arch present here, that is called dorsal venous arch. From the lateral end of the dorsal venous arch, the cephalic vein starts. Because I will talk about this, so you must know that from how the veins start. Because what is the function of veins? They carry the deoxygenated blood of the body. So the cephalic vein starts at the lateral end of the dorsal venous arch, running upwards, lateral side of the forearm, then lateral side of the arm, and here it is piercing the vein, the subclavius part that I don't want to tell you at present. Is piercing, and finally it opens into the part of axillary vein. The medial side of the dorsal venous arch, the basilic vein starts. So basilic vein starts from the medial side of the dorsal venous arch, running its course to the part. One is lying on the lateral side, another is lying on the medial side. And the two, basilic vein and cephalic vein, at the elbow joint, they interconnected with this, and that is called intercommunicating vein. So whenever we give the intravenous injections or intravenous drip, we put the cannula here. Follow? Very simple. On the lateral side and on the medial side of the forearm, there are the two veins, cephalic vein and basilic vein. Both the veins, they are interconnected with each other at the elbow joint, and that is called intracubital vein. So whatever the intravenous injection or the drip, because this vein is very easily identifiable. So generally the nursing staff or doctors, they put the cannula here for the intravenous injection. Very simple. और any problem? देखिए दो vein बोली है मैंने, basilic vein and cephalic vein. Both the veins, they are connected here with this, like this. That is called intercubital vein. So whenever we give the intravenous injection, the intravenous injections are most commonly given at this intercubital vein. So that is all you must know about the part of the upper limb. Now come to the pectoral region. As I told you, the pectoral region, now look here, in the pectoral region, there are the certain things which you can see and identify, because we will use repeatedly all these things which are superficially seen. So what are the superficially visible structures? First of all, the subcutaneous bone, that is clavicle. You can see the clavicle very easily. So you can palpate the clavicle without any problem. Look here. This is the medial end of the clavicle, the same on the medial end of the clavicle on that side. What is this? Sternum. sternum has having the body, and above the body there is the manubrium, and this joint is called manubriosternal joint, or this angle. And at the manubriosternal joint a ridge is present. A ridge is present, and this angle at this lateral side of the manubriosternal joint, there is the second costal cartilage articulate. You see, all these are the ribs, and the ribs are articulating with the body of the sternum by this purple color line. These purple color structures are the costal cartilages. These purple structure colors are the costal cartilages. So, at the manubriosternal joint, this is called sternal angle or angle of Lewis. Sternal angle or angle of Lewis. At the side of the sternal angle or angle of Lewis, the second ribs articulate. Count कर लीजिए. What is this? First rib, and this is the second rib. So second rib articulating with the sternal manubriosternal joint, and this is called sternal angle. So we will ask you while this surface marking, count the ribs. Which rib is this? So how you will count? You starting your count from the sternal angle, because we are sure at the sternal angle which rib is articulating second rib. So go down, second, third, fourth, fifth, sixth, like this. So is it not a landmark for counting the ribs? Sternal angle is used, or angle of Lewis is also used as a landmark for counting the ribs. At the sternal angle, starting the second rib, go down, third, fourth, fifth, sixth. Okay, no problem. And the 7, 8, 9, 10, they are articulating with the part of this. So up to the 7th ribs, they are articulating directly, and rest of the ribs, they are articulating their costal cartilages, and the 11th and 12th ribs, they are not articulating with the sternum. Those are called the three floating ribs. Those are called floating ribs. All right, that is a different thing. Our point is this. So the structures you will see in the pectoral region. One is the clavicle, second is the sternal angle, and just about this, just superior part of the manubrium, you can see here the notch, that is called suprasternal notch. Suprasternal notch. And you will also see here the nipple, and if the cadaver is female, you can see also the breast. So all these structures you can see here in the superficial part of pectoral region. So before starting the dissection, identifying all this, where is the suprasternal notch, where is the clavicle, and all this. The next thing, beside this, look here, this is the clavicle, and this is the medial part of the clavicle, this is the lateral part of the clavicle. At the junction of medial or the middle part, or just going to the lateral part of the clavicle, you can see here there is the fossa, which we can feel and can also feel in the cadaver. That is below the clavicle and fossa. So very simple, infraclavicular fossa. Infraclavicular fossa. So this infraclavicular fossa can also feel here. And coracoid process, just below the infraclavicular fossa, you can feel the projection, that is the coracoid process of the scapula. And this is the Gifford process. Besides this, at present, you must also familiar about the different lines which we will use by giving the incision. Starting from the center upper end of the manubrium, going downward, straight, or you can say that starting from the suprasternal notch, mid point of the suprasternal notch, draw the line downward up to the Gifford process, that is mid-sternal line. What is this? Clavicle. Take the midpoint of the clavicle and draw the line downward from the midpoint of the clavicle to the part of here in the lower limb, and that is called the mid-clavicular line. Mid-clavicular line, and in the axilla we draw, this is the anterior axillary line, and similarly we divide this axilla into the midpoint, that is the mid-axillary line, like that, and posterior axillary line. So these are the various lines which we will use. I will give you demonstration for that, how you will give the incision, and the teacher will come to your table and they will mark the line over the cadaver. That will be more simplified. Okay. Now I come to the different part. The pectoral region is having the superficial fascia, the deep fascia, and also the clavipectoral fascia. So in the region of pectoral region you will come across the three types of fascia. Superficial fascia, as the name, superficial fascia is very thin. No doubt, in pectoral region the deep fascia is also thin, except that in case of female, the superficial fascia is having some fat, that is for mammary gland. Otherwise, rest of the part is having the thin fascia. There are the different structures which you have to see in the superficial fascia. Listen, we will not base the body just like butcher. Butcher we काटता है. There must be difference between the butcher and doctor. As you will see the superficial fascia, in superficial fascia you will come across the cutaneous nerves. You will see the cutaneous nerves, identify the cutaneous nerve, and if the body is female, mammary gland, preserve the mammary gland. The next class will be of the breast. Afterwards, you will dissect the mammary gland, not today. Besides this, you will see the one muscle, which is subcutaneous muscle. Only the body is having that subcutaneous muscle, that is platysma. And that platysma is responsible to giving our smiling face and expression of the face are because of this platysma muscle, that is subcutaneous muscle. That will also come in the superficial fascia of the skin or pectoral region. All right. Let's see the cutaneous supply which you will see in the pectoral region. For that, what is this? External angle. From the external angle, we see or take the limits of the external angle, draw the imaginary line from external angle towards lateral side. Okay. Just above this line, you are seeing the three nerves. These are the branches of supraclavicular nerves. Root value are C3 and C4. So, the cutaneous supply above the horizontal line. What is the horizontal line? That line we consider from external angle to the lateral side. Imaginary line, or just you can say that above the external angle, the cutaneous supply is from the supraclavicular nerves. The root value are C3 and C4. One thing. Below the horizontal line, that means this part, the cutaneous supply are coming from the intercostal nerves. That is the nerves of the intercostal, that is space between the two ribs, that is called intercostal space. The nerves present here is called intercostal nerves. So below the horizontal line, the intercostal nerves which are having the root value from T2 to T6. Okay, very simple, you can remember. above the horizontal line, the cutaneous supply is from C3 and C4, supraclavicular nerves. Below the horizontal line, the cutaneous supply is from T2 to T6, intercostal nerves. Okay, you reply well, but my question will be, what happened to in between these two? Above the C3, C4, up to C4, and below is from T2 to T6. What happened to the C5 to T1? Those are forming the brachial plexus. Understand? The root value from C5 to T1 are forming the brachial plexus. So that will be your answer. Is it clear? देखिए ऊपर वाले पार्ट में कहाँ तक चली गई C4 तक, C3, C4, and below the horizontal line from T2 to T6. So in between these two, left are C5 to C6, C7, C8 and T1. These branches, they are forming the brachial plexus, so they are not providing here cutaneous supply. Clear? That thing I want to tell you. And keep this thing in your mind. Always ask the question. You replied well. The last question will be this. And if you will answer, you will get the marks from my side. Okay? Now, after this, I come to the second point. That is, which muscle which is subcutaneous? Platysma. The platysma is the subcutaneous muscle having no bony attachment. Having no bony attachment. So, if the question asks you in the MCQ, which muscle which is having no bony attachment, that is platysma. Okay? Why don't you write, girls? It is better you go and sleep. Why are you wasting your time and energy? This platysma, it arises or takes origin from the deep fascia of the platysma, pectoralis major muscle. The muscles of the pectoral region are pectoralis major, pectoralis minor and subclavius, and all these muscles we will just talk now. I am taking you platysma, P-L-A-T-Y-S-I-S-M-A, platysma. So platysma is the subcutaneous muscle, takes its origin from the deep fascia of the pectoralis major muscle. So can we name this as pectoral fascia or not? So it is taking origin from the upper part of pectoralis major muscle fascia, deep fascia of the pectoralis major, and literally from the deep fascia covering the deltoid muscle. This is the deltoid muscle. So it is taking origin from these two. The muscle of the both sides is forming the sheet, and that sheet is passing over the clavicle. That sheet is passing over the clavicle, come into the neck as a sheet, and as it is reaching to the lower border of the mandible, partly it is attached to the lower border of the mandible, and other parts are attached with the superficial fascia of the lower part of the face. Here it is attached with the angle of the mandible and also the lips and also to the part of orbicularis, lower part of the orbicularis occuli muscle. So that is the way how the platysma is attached and taking its origin. Okay, we will talk this again when we will teach you the head and neck region. When we will talk of the facial muscles, again you will come across the platysma. At present, you just understand what is the platysma and how it arises and how it inserts. Okay. After this, I come to the next part. the different muscles of the pectoral region. Look here, there are the three muscles: pectoralis major, pectoralis minor, and subclavius. These are the muscles which we will discuss. One thing, as superficial fascia we have talked, the deep fascia which is covering the pectoralis major muscle, that is called pectoral fascia. And there is the third fascia. I want to tell you about that fascia. This fascia is very important and commonly asked. Clavipectoral fascia. Look here. The clavipectoral fascia is the fascia which is present in the space between the lower border of the clavicle look here, this is the clavicle and here comes the pectoralis minor. Look this part, this is the pectoralis minor muscle and this is the clavicle. So the space between the inferior part of the clavicle and the medial part of the pectoralis minor muscle is filled up with the fascia. That fascia is called clavipectoral fascia. And generally the short note asks in this clavipectoral fascia. Look this diagram. The question asks, write short notes on clavipectoral fascia. So clavipectoral fascia is the part of deep fascia which is present in the space between low inferior part of the clavicle and the pectoralis minor muscle. This fascia, look, above it is attached to the clavicle. This clavipectoral fascia, above it is attached to the clavicle and downward it is continued with the axillary fascia, that is the fascia of axilla. Now see, as the fascia attached to the upper part of lower inferior part of the clavicle, here look, this is the deep fascia, green color. This deep fascia above, it is split into two layers and these two layers they enclose the muscle, that is subclavius muscle. So point is this, the clavipectoral fascia in the upper part splits into two layers and these two layers enclose the subclavius muscle. As it comes down, look the diagram, as it comes down, again it splits into two layers and here it encloses the pectoralis minor muscle. Then it is coming down, the two layers fused and these two layers fused and forming the ligament which is attached to the axillary fascia, that is called suspensory ligament. The purpose of suspensory ligament, look the axilla, there is the depression. This suspensory ligament maintains this suspension of the axilla. It is pulling down the axillary fascia, so maintain the dome of axilla, that is suspensory ligament, and suspensory ligament is the part of clavipectoral fascia. Okay, and as it's coming from after covering the pectoralis minor muscle, this fascia passing laterally and laterally it is continued into the part of axilla. So that is the attachment of clavipectoral fascia. Now why it is important, why it is commonly asked in the short note? The answer is that this clavipectoral fascia is piercing many structures. So one diagram is this and another diagram. Yes boys, I have not taken that diagram, sorry. That you write down the structures, I will show you. It is pierced by lateral pectoral nerve. The clavipectoral fascia is piercing the following structures, and these structures are lateral pectoral nerve, cephalic vein, thoracoacromial artery, and also the lymphatics coming from the breast open into the axillary lymph nodes. And all these are showing in the diagram, in which we will make the diagram. One is that clavipectoral fascia, and another diagram like this, which is given in the every book. How I forget. So in that diagram you will show all these structures: cephalic vein, thoracoacromial artery, lateral pectoral nerve, and the lymphatics of the breast. So all these structures, they are piercing the clavipectoral fascia. As I told you, the infraclavicular fossa. All right. Similarly, on the lateral end of the infraclavicular fossa, this is the deltoid muscle, and here comes the pectoralis major. A groove existing between the two, that is called deltopectoral groove. In this deltopectoral groove, there is the cephalic vein. The cephalic vein, which is beginning from here and coming into the part of here. In this deltopectoral groove, you can see the cephalic vein, and downward to the infraclavicular fossa, there is the part of clavipectoral fascia where you can see all these structures piercing the clavipectoral fascia. We will show you in the dissection also. So that is the importance of this clavipectoral fascia. So in all the fascia, the clavipectoral fascia is very important, and generally the short question is asked, what is the clavipectoral fascia? And for that, keep one thing in your mind: draw the well-leveled diagram. If you will draw the diagram, the teacher will not read the rest of the part, because you have mentioned each and everything in the diagram. What are the structure piercing the clavipectoral fascia, and that's all right. Now come to the muscle one by one. Look, see, pectoralis major muscle. This pectoralis major muscle, no doubt, is a thin sheet, very thin muscle, but very important muscle. It is a larger thin sheet of the muscle having the two parts: the clavicular part, which is coming from the clavicle, and the sternal part, that is called sternocostal part. So pectoralis major muscle, which is a fan-shaped muscle, is having the two parts: clavicular part coming from the clavicle, and the sternocostal part coming from the sternum and costal cartilages. Whenever we talk of the any muscle, generally we use, nowadays it is slightly changed, attachment of the muscles. The one end of the muscle is remain silent or not moving. Another end of the muscle during the movements contracts. So that part of the muscle which is contracting during the movement, that is called insertion. And the part of the muscle which is fixed at the another end, that is called. So we have developed the habit origin insertion. So follow this. The pectoralis major muscle originates from the clavicle and the sternocostal end. And third part, look here, the green color lines you are seeing, that is aponeurosis of the abdomen. So these are the three sides from which the muscle takes origin. First of all, clavicular part. The clavicular part of the muscle takes origin from anterior surface of the clavicle from medial to third. or you can say the anterior surface of the clavicle from middle half. That is the origin of clavicular part. The sternocostal part taking origin from the lateral surface of the sternum up to the level of 6 costal cartilages. Count this: second, third, fourth, fifth, and sixth, up to the 6. So, lateral surface of the sternum and also from the up to the 6 costal cartilages. That is the origin of sternocostal part. So we know the origin from the clavicular part and sternocostal part. Besides this, the third, it takes also origin from the aponeurosis of external oblique muscle. So these are the three sides origin of the pectoralis major muscle. Clavicular part from the external surface medial 2/3 of the clavicle. Sternocostal part from the lateral surface of the sternum and also from the costal cartilages up to 6 costal cartilages. That is sternocostal part. And also third from the aponeurosis of the external oblique. The muscle is inserted on the lateral lip of bicipital groove. I hope everyone is knowing the bicipital groove. You have seen the humerus bone. There is a groove in the upper part of the humerus. This groove is called bicipital groove, and on the lateral lip of the bicipital groove there is the insertion of the pectoralis major muscle. And medial side there is major, and in the groove latissimus dorsi and the blood vessels. All right. So insertion of the pectoralis major muscle on the lateral lip of the bicipital groove. But the books, they are habit to make students some complicated. Very simple. Insertion, you remember this, insertion on the lateral lip of bicipital groove. Give the examiner. Sometimes the students are on the wrong impression that I will speak more, I will get the full marks. They start telling the insertion is just U-shaped band. The U-shaped band is having the anterior lip and posterior lip. Both the lips, they unite and inserted on the lateral lip of bicipital groove. Very simple. The anterior lip is formed by the clavicular part and posterior lip is formed by the sternocostal part. Both these U-shaped bands, anteriorly the clavicular fibers, posteriorly the sternocostal part, and they join and they attach to the lateral lip. आगे बहुत याद करना है. Don't we go so detailed. No doubt, the clavicular part is forming the anterior lip. The posterior lip is formed by the sternocostal part. I told you, but not necessary to remember. If the examiner forces you, then you reply. The important part, the action of the muscle. The clavicular fibers of the pectoralis major muscle. The clavicular fibers of the pectoralis major muscle, they act with the anterior fibers of the deltoid. Anterior fibers of the deltoid and helps in the flexion of the arm. Now be careful. I am using the word flexion of the arm. Don't do this. Flexion of the arm, this one. Extension of the arm, this one. Abduction of the arm, this one. Adduction of the arm, this one. So the clavicular fibers of the pectoralis major muscle along with the anterior fibers of the deltoid helps in the flexion of the arm. This movement. While the sternocostal part and the flexion of the arm when you require. Try to understand. if you want to pushing the hard thing, what will be your action? You want to push the hard thing. You are doing this action, not like this. आपको कोई चीज पुश करनी है हैवी, तो कैसे करेंगे? पहले हाथ यूं रखोगे, then you will do. So pushing the hard thing, we are doing this action, and this action is. अरे तिवारी जी, मैं क्लास ले रहा हूँ, मॉर्निंग गोडी रहती है, अभी क्लास लेने दो मेरे को, बाद में बात करूंगा। भैया मैं अभी क्लास ले रहा हूँ, उसके बाद में छोड़ूंगा। ओरेशन। So pectoral is major muscle action, you understand, that is clavicular part, sternocostal part. The sternocostal part, when we are climbing, we hold any tree or anything and climbing. What will be action in the climbing? Your arm is abducted above the head, like this, and in this action what is happening? Thorax is also elevated, and we pulled our body upward. So the muscles, sternocostal muscle, and when we pulled our body upward, the latissimus dorsi muscle also act. So in the climbing or in the forceful inspiration, you understand the forceful inspiration, naak band kariye and take the breath. When you are taking the forceful inspiration, also it elevates the thoracic cage, that is sternocostal part. Of your mobile while coming in the class. So that is the action of the sternocostal part. So sternocostal part is helping in extension from the flexed arm. Now I am saying, try to understand, it also extends the arm, flexed arm. I am doing the flexed arm, okay, and extension. So when this movement required, if we want to pull something, heavy thing, suppose if you want to pull this, so what will be your condition? Like this, you are holding this and pulled it. So this is the action. So sternocostal part helps in the pulling action from or it extends the flexed arm. It extends the flexed arm during pulling the higher or heavy objects. भारी चीज को आप पुल करेंगे, किस कंडीशन से करेंगे? फ्लेक्शन से पकड़ेंगे, and this is extension. So that is the action of the pectoralis major muscle. Clear? I have told you both the parts, and combinedly clavicular part and sternocostal part, combinedly they help in the adduction and medial rotation of the arm. I told you the three things. The action of the combined pectoralis major muscle. Suppose I ask you, what is the action of pectoralis major muscle? You speak flexion of the arm, reduction of the arm, and medial rotation. That's all. Okay. But if I ask you what is the clavicular part, then you reply that clavicular part along with the anterior part of the deltoid muscle, it helps in the flexion of the arm. Sternocostal part Again, you reply, acting with the latissimus dorsi helps in climbing and also help in the forceful inspiration. The nerve supply of the muscle is receiving its nerve supply from medial and lateral pectoral nerve, both the nerves. The lateral pectoral nerve root value is C5, C6, C7. That you will understand when we complete the brachial plexus. At present, you just write down the C5, C6, C7. That is the root value of the lateral pectoral nerve. Medial pectoral nerve, the root value is C8, T1. Then come to the part of pectoralis minor muscle. The pectoralis minor muscle is a small muscle. Look this muscle. This muscle taking origin from the third, fourth and fifth ribs and the part of costal cartilage. Pectoralis minor muscle origin, it is taking origin from the third, fourth and fifth ribs. The muscle is inserted at the coracoid process of the scapula. The root value of the nerve is same, lateral and medial pectoral nerve. The action of the muscle. Pectoralis minor muscle, it acts along with the serratus anterior muscle. It acts along with the serratus anterior muscle and helps in the punching action. Or what happens in the punching action? The scapula comes forward or not? आप ऐसे करके देखिए. Scapula comes forward. That is called protraction of the scapula. Protraction of the scapula as the scapula comes forward. During the boxing, there are the two, punching and pushing. So these are the main action of the serratus anterior muscle that I will talk just now. That is the main action of the serratus anterior muscle. And the pectoralis minor muscle, it helps in the serratus anterior muscle in protraction of the scapula. After this, come to the next, the subclavius muscle, very small muscle. The subclavius muscle, it is taking origin from this costal cartilage which is attached to the first rib. So it is taking origin from the first costocartilage joint or first costocartilage junction. The subclavius muscle takes origin from the first costocartilage joint and it is inserting on the inferior surface of clavicle. Have you reached the clavicle? Yes or no? On the inferior surface of the clavicle there is a groove. So the subclavius muscle is inserted in the subclavian groove. The nerve supply of this muscle is special, nerve to subclavius, and this nerve to subclavius is coming from the upper trunk of brachial plexus. Upper trunk of brachial plexus. Nerve to subclavius is the nerve supply of this muscle, and that nerve is coming from the upper trunk of brachial plexus. The action of this muscle. This muscle, look here, it keeps the medial end of the clavicle downward and steady. The subclavius muscle on action, it pulls down the medial end of the clavicle downward and keep steady. So during the movement at shoulder joint, the clavicle is remain in steady position. The medial end of the clavicle, कहाँ पे insert हो रही है muscle? Look, यहाँ से arise हुई and medial ends पे intraclavicular groove में subclavian groove में insert हो गई. So it keeps downward infero-medially of the clavicle during the movement at shoulder joint, or it is steady during the movement of shoulder joint. How it is steady? It pulls down the infero-medially part of the end of the clavicle. After this, the one more muscle, no doubt, it is not a muscle of the pectoral region. serratus anterior muscle. The serratus anterior muscle, which is coming from the, look this diagram. It is arising from the outer surface and upper border of the lower 8 ribs. And from this lower 8 ribs, the origin muscle takes origin from this part and inserting on the, this is the costal surface of the scapula, on the medial border of the costal surface of the scapula. The action, the nerve supply of this muscle is long thoracic nerve, C5, C6, C7, and the action of this muscle that it keep steady the medial border of the scapula. It keep the medial border of the scapula in proper position, contact. And the action of the muscle, it is a boxer muscle. All the punching and pushing actions are carried out by the serratus anterior muscle. Okay. The person whose long thoracic nerve is injured, they will come in this position. The medial border of the scapula becomes prominent. Medial border of the scapula becomes prominent. Normally, the medial border of the scapula is not prominent. Okay, and the person cannot do overhead abduction. Such condition is called winging scapula. Winging scapula, just like wings of the scapula, they remain in this position. That is all about the pectoral region. Okay.